So the session was on implementation science, bridging research to practice. I had the privilege of facilitating the session, and we talked about all aspects of how to conduct implementation science. We talked about using the Nspire model, the definitions of nursing science and implementation science, and we got into a robust discussion at the end with the audience about the dissemination piece of it, which is so important. Once we conduct studies, it's so important to make sure that the information is not only implemented, but disseminated so that others can also implement it so that we reach more patients as far and wide. So it is, it's defined a number of ways. The textbook definition is the study of the methods that take research and implement them into practice. And it's so important because it's what creates the evidence for practice. We conduct the research studies, we find the evidence for whether it's investigational or implementing a type of intervention. But the important part is, how does that really impact patients? It's all about the patients, about patient care, quality of life, prevention, survivorship issues, and of course, overall survival is always the goal with patients with cancer. And then in the future, looking toward prevention, and eventually, if we can, prevent everybody from becoming patients, that's the ultimate goal. But for implementation science, it's finding those answers to those rich research questions, and then taking that to the next level, getting it to not just test it in a small cohort of patients, but disseminate it throughout a much larger population, so that we are making a real change in practice. So dissemination, part of it is like being at this meeting, you give presentations, publications are a huge part of that. You can do it small scale internally. A lot of times within our institutions, we'll disseminate locally from unit-based or institution-based, but then the large-scale dissemination really comes in the form of the publications, and then going to these types of meetings and presenting and networking and sharing the information with each other. It's essential to share what we learn. And that's a large part of the whole data science and the Moonshot initiative and everything that's going on in the world of genetics and genomics. So the large databases that contain information or the data from multiple studies that then can be compositely investigated. So it's another form of dissemination by sharing this information and then looking for common data elements, so that we can get a much better picture of different people and different cultures, so that it really comes down to that tailored care. We talk about precision medicine, precision health, and this is all part of how we get there. And the dissemination part is just really essential for that. So one of the large initiatives that's really now, I think, in its second year is the All of Us initiative out of the National Institutes of Health, and that is a goal to enroll over 1 million patients worldwide so that we capture every culture and every background from both genetic and epigenetic areas, so we can get the phenotypes as well as the genotypes and really understand who we are as a population so much better. And that type of large thinking, that type of collaborative research is where we really, you could say the rubber meets the road, where we get to the point of care where we make huge impacts really in our population at large. Sure. So the Nspire model was developed by Gwen Wallen from the NIH Clinic Center, and it's a really nice algorithm that helps you differentiate between whether you need to conduct a research study, an evidence-based practice project, or a quality improvement project. So if you have, if there's a need, let's say on a unit or for a certain patient need, you can look through the literature or ask your colleagues and see what, are you using the most current evidence-based practice in this area? If you are, but it's not working right and something needs to be adjusted, then you need to conduct a quality improvement project. If you're not using the most current evidence-based protocol, but there is evidence out there in the literature for it, or in other areas or guidelines, you incorporate that into your practice and evaluate it. That would be an evidence-based practice project. If there isn't and you need to create new knowledge, then that is a research study. So the Nspire model helps you to decipher, kind of going through this algorithm of what type of project or study you need to conduct based on your question or your need for whatever patient issue comes up. So it's a beautiful model, and I think that it's something that everybody should use in this area, and it fits so nicely with implementation science because it does cover the whole gamut from research to practice. There were certain pearls that did come out of this session. So one was on cultural humility. So really being respectful of different cultures around the world, different patient needs. As you do these implementation science studies, it's not just about being rote in what you believe in, but really hearing the voice of the patient and engaging with the patient. Well, the basic overall take-homes really were about hearing the patient's voice. I think that was probably the biggest take-home, being culturally sensitive, and just having a lot of integrity in everything you do, and just making sure that that there's clinical meaningfulness at the end of the road. Yeah. It's a complex field, implementation science, as any area is. It is, again, the study of the methodology. So there are many different approaches to it. There's that dissemination piece again, like we spoke about. One way to get there is thinking about pragmatic research, which is kind of real-life research, people in their natural settings. And that's needed because when we do things that are more kind of very structured and laboratory-based, it doesn't always translate to the real-life setting. So I think a lot of those pearls came out of the session, and it was, again, it was a lot of fun. It was a lot of, it was thought-provoking, and I think we all got a lot out of it. There were some thoughts about that we don't do enough as nurses, as nurse scientists, in the not just implementation science area. We did talk about the fact that the funding for translational research through the National Center for it's called NCATS, for translational research, there's very few nurses actually tap into that funding mechanism. Yet, if you look at nursing science, which is so holistic in nature, and implementation science, which runs that gamut from research to practice, nurses are well positioned to be the ones to conduct these types of studies, to be the leaders of these types of studies. Yet we don't have a lot of the funding, for that. We have a small portion of it. So I think that that we need to kind of look to this area a little bit more. We need to throw in more grant applications so that we can conduct more of these studies, because I think we are really well positioned as nurse scientists to do this. Yeah. There's going to be, I believe, a grant mechanism through the ONS Foundation for implementation science coming up, so stay tuned for that. Okay.